Osteoarthritis of the knee is very common in the adult or more mature population. And when we're dealing with arthritis of the knee, it can be varying amounts. We can have decreased joint space, we can have meniscal damage, or usually end stage, worst stage is bone on bone. And a lot of times these people need surgery or knee replacement for that. What studies are now showing, which is phenomenal, is that shockwave, true shockwave, can actually help with bone on bone knee. Now, are we growing back the meniscus? Unlikely, that has not been demonstrated. Are we growing back the articular cartilage, which we really need? We're not so sure about that either, probably not. But what we do know is occurring is that by creating angiogenesis or new blood supply in the joint capsule and or in the bones above and below, it's bathing that joint and giving people lubrication, and then they're able to participate in sport and walk and have a great quality of life. And the studies validate that. Now, a couple studies also show we only want to treat the bones above and below the knee, which is fascinating because you think that we'd only want to be in the joint space. But that neovascularization in the bone, again, is creating almost what's called an imbibition process, which we see in the spine. Imbibition is the pumping of bone, pushes fluid into the space in between. In the spine, it's the disc space. In this region, it would be into the joint space where the actual meniscus would have been or is damaged or is no longer there. So when we work on the knee, when we stem wave the knee, after we've done proper mapping, obviously, and we would usually have diagnostic imaging to validate this, we're going to put our gel, let's say we're on the lateral side here, across the joint line. We will then set our protocols, our parameters as per the protocol sheet, which we have, to treat the lateral knee, the osteoarthritic or the joint space. We're going to take the applicator head, put it on the skin. We're going to start at the proximal tib-fib joint because the hamstring does attach on the back side of that. And we're going to move up through the lateral tibial plateau, through the joint space area. We can then go back and forth around the actual lateral joint because the shock waves will penetrate into the tissue. And then we're going to come up onto the lateral femoral condyle as well. Remember, the objective is to get into the joint itself, to get the bone below and the bone above. We are looking to cut pain and inflammation, and also with repeated treatments, and after several weeks of time, create new blood supply in that area to bathe that joint to get it healthy.